SMGL is a public-private partnership between the Ugandan Ministry of Health and the United States government, primarily represented by the Centers for Diseases Control and Prevention, CDC, and the United States Agency for International Development, USAID. The Infectious Diseases Institute, IDI, is the lead implementer of the Saving Mothers Giving Life project in the Greater Kibale districts of Kagadi, Kakumiro, and Kibale. The goal of the SMGL project is to reduce maternal mortality by 50%.
It is a pilot, or started as a pilot, to demonstrate that with strengthened health systems, you can reduce maternal mortality by 50% within a period of 12 months. We hired staff to augment the existing district staff. All health center force and the district hospital were renovated and equipped with equipment to make sure that they are able to carry out the operations that are needed. We recruited and have been supporting the required healthcare workers, including doctors, to carry out the operations. We've been supporting these facilities with the logistics needed, drugs, gloves, and all sorts of logistics they need to make sure that they are able to provide a maternal and child health service. So we also supported the districts with both motorcycle and motor ambulances so that they could refer clients from rural facilities or the villages to the facilities at Health Center Fund District Hospital, where interventions can be carried out in a timely way.
One of the roles we played is that we used to monitor and supervise these programs. The cordial working relationship of IDI staff and the district leadership was very good. Very good, very good. And that's why we interested ourselves in implementing these programs.
It has impacted positively on the lives of the people within the region and within the district, and more so on our local systems, especially for delivery of services across the board.
The end-line evaluation of SMGL in the district is being conducted using Ramos. This census involves collecting information from all households, including retrospective information on deaths that the household has experienced since the 1st of January 2016 until the time of the data collection. This includes the deaths of all reproductive-aged females, 12 to 49 years of age, that occurred in these districts.
It's unique and most useful in an area where we have weak vital registration systems and also weakness in ascertaining the causes of these maternal deaths. And so it is really the appropriate method to use to gather this information of women of reproductive age in the various communities.
Since January 2016, and the number of infants who died before the 28th day after birth since January 2016. The main goals of the study are to collect fertility and mortality data on the general population, including maternal mortality, and to estimate the impact of the SMGL initiative on reduction of maternal mortality.
Before we started the activity, we conducted household listings. That's to find out the number of households in each of these districts. This was done by the existing VDCs. And through that, we were able to tell the workload we had at hand. And these included about 180,000 households that we had to go through. And it's through that we set our targets in terms of the timelines and even the individuals we had to use.
9 district M&E supervisors and 39 Ramos supervisors were trained during a Ramos training of trainers, which took place in Kampala in August. The training focused on how to complete the household questionnaire and the supervisory roles.
Each questionnaire had a serial number in order to ensure that every tool is monitored. We know we have issued out this number of questionnaires and these particular serial numbers have gone to this particular data collectors, and even if it's spoiled, you really need to account. We had a database with all the unique identifiers to know that if it's 001, that is village in this particular sub-county, and then you can even track who collected that data, because even the data collectors had unique identifiers. Once you get this questionnaire, you can know it came from this village, you can know who collected the data, you can know who was the first reviewer and then the second reviewer before actually sent for data entry.
The study engaged village data collectors and parish coordinators to collect data from the households in their respective villages. The VDCs and parish coordinators were selected from an existing VHT system that has previously been used by IDI.
SMGL, in its delivery of services, would work with VHTs. Even in this study, they worked with village health team members to ensure that they collect the data in the different villages, in the different sub-counties.
The VDC we work with, their level of education is minimal. But these are the people, if you want to achieve, you have to work with the people who live within the community you want to get data from.
We had to retrain these people in what they are supposed to be doing several times to go through.
The VDCs were committed to the task at hand. They devoted time outside of their personal schedules to follow up their communities.
We're working too in this area. I was given 200 households, but out of 370. The thing which has helped me to do those houses, I'm being familiar with some people. The geographical location of this place was good. So even the language, I was used to very many languages. So it was easy for me to interact with various groups of people.
Eshonga ya nyambire kankoresaga okoresa mapu y'ekicweka kanje na organizinga abantu ndara mbagambire nyeyo questionnaires eziri kubasa kuba nizimara abo bantu ndarana programu yo kubakoraho bona nkabaheza ndere mbagambire umurimo gwindi kwenda kubakoramo nkamara hagati aho mpaho nagura kano kagari niko mbere ndi kuribatiraho umubwire bwo kumarira biso kubanza ndi kutandika kabanta kine.
After submission, as a quality check, the questionnaires were verified at 3 levels: PC, Ramos supervisor, and district M&E before submission to IDI offices in Kampala.
Ndina ba VDC 10 era bona training bagiberamu ne basomesebwa bulungi questionnaire ne bagitegeera kyakufayo n'okukozesa obuvunaanyizibwa obunaweebwa okumonitoringa aba VDC baffe ninjeyo data gye bakola ninjiriza pa sub-county waffe.
After the VDCs collect the information, they recorded the information from the mass, that's from the public. They hand the report to me. I revise the report. There are certain forms which I also fill, which is summarizing what they have collected. Then I take that report to my immediate supervisor, that is the sub-county supervisor.
When they bring the completed forms, I go through to also see that they are well completed. Those ones which are not well completed are taken back. So far, I have received and verified about 3,500 questionnaires. In between the week, I would go up to the field to give on-spot checks and on-the-job training where there is difficulties.
We do support them by reviewing their work, by providing the technical support. If they find challenges out there in the communities, if they find challenges with their PCs, if there are some VDCs that fail to execute their activities, or if they find maybe stumbling blocks, resistances in the communities, we come in and support.
It is you to verify last. So you've got to be very careful before you send it to Kampala for entry into the system.
The Infectious Diseases Institute wants to be an organization that learns. Here are some areas that were identified during the 3-month study.
So we were working with various partners from the Ministry of Health level to the district local government leadership, both technical and political, and other implementing partners that were in the districts that we oversaw.
We engaged the LC3 leaders, we engaged the LC5 leaders, we engaged the cows, we informed the DHOs. So that's why you see we've experienced limited resistance.
They had a courtesy of updating us. They would keep me posted on each and every activity that was going on.
It involved district leaders right from the top through the different levels of management to the lowest at community level. These engagements really paved a smooth way of dealing with IDI in its transactions.
It's important to work with the locals to derive information or data from their fellow people.
I had weekly meetings with the parish supervisors to give me information how far they've gone, the challenges they're facing, and together we sit on round table and brainstorm on how to overcome the respective challenges.
We are just planning to do a mop-up and look at exactly whether these people have really covered all